Do you feel that your breasts are a little bit too small, or would you like a lift? Well, PRP and PDO threads are a great combination to provide both of those things. And I'm going to show you a PRP vampire breast lift followed by a PDO thread lift right now. So I've already drawn my patient's blood. I've already spun it down, and this is our PRP right here. And so we're going to inject platelet-rich plasma into a couple areas of her breast, and then we're going to inject platelet-poor plasma in the rest of her breast. And what happens is the platelets are going to recruit her stem cells over to where they are, and the stem cells are going to become brand new breast tissue. It can also make brand new nerve endings and blood vessels as well. So if there is any nipple insensitivity, we can make those more sensitive. And then over the course of the next 4 months or so, she'll notice an increase in size up to 2 cup sizes. So that's a great bonus of doing a PRP. There's no surgery and there's no downtime. So I have already put numbing cream on her, and I've already wiped her off with some antiseptic, but I will show you. You ready to go here? Mm-hmm. Okay, so we're gonna start right over here. 1, 2, 3, la la la, here we go. And so the PRP is just being injected right along the cleavage line. Give her some more oomph there. And she'll notice today and tomorrow and probably the next day that she'll have fuller breasts, but then her body's gonna absorb these platelets and the fluid, so then she will be like, huh, where'd that go? And then they're going to do their magic, which is to recruit the stem cells. So that's one injection spot. We're gonna go ahead and do a second one. You ready? Mm-hmm. Okay. Ready, 1, 2, 3, la la la, here we are. And so easy. I mean, relatively easy considering surgery is a much more difficult downtime and more risks. This is all your own blood and your own platelets, so there is no risk, and there's really no side effects for this treatment, which is great. So that's the PRP, and now I've got platelet-poor plasma, so we're gonna just keep going around her breast. And again, I had already wiped her, but we'll just wipe her again. All right, one more here, la la la. There we go. This might be a little bit more spicy. Sometimes people feel this a little bit more. You doing okay? Mm-hmm. Okay. And we're just gonna keep going around her breast. She is a great patient. Maybe because she's being filmed and doesn't want to talk. But maybe because it's so easy. Is it so easy?
It's not near as bad as I thought it was gonna be.
Oh, good. Okay, awesome. Nice like that. Okay, and now we're gonna go a little bit farther down. Yep, turn a tiny bit onto your shoulder. Yep, just like that. We're gonna go a little bit on the side here. Ooh la la. And you can get some bruising. I don't see any bruising happening on her, but you could, because we are using needles. But I'm gonna move over a little bit this way. La la la. I don't know why I'm la la laing, but it's just what I do. And you can already see how much perkier her breasts are just with the PRP injections. So again, the final results are going to take a few months because it does take a little while for your body to form adipose tissue and new blood vessels and new nerve endings. Okay, one more here. La la la, here we go. And so you can use platelets to do any number of procedures. Obviously, this is one of them, the vampire breast lift, but we can use it, we can do PRP facials. And so the facials are where we take the platelets and we put them on your face and then we microneedle them in. Here we go again. And we can do a face lift with the platelets. So that would be where we use the platelets like filler. So if you're a little bit nervous of filler, we can inject them underneath your, like your cheeks or your nasolabial folds or your marionettes. And then again, your platelets are going to recruit stem cells to migrate to where they are, and then you're going to form new collagen and new elastin right where we put those platelets. A lot of times at the vampire facelift, people will put filler first, and then we'll put the PRP in afterwards, like immediately in the same treatment. So that way, as the fillers give you an immediate lift, and then as the fillers break down naturally, the platelets are kicking in and they're making brand new making brand new collagen, elastin, and fibrin. So that was her first breast. I'm going to take a little break and take her numbing off the other side, and we'll be back in a minute. So now we've moved over to the other breast, and I'm going to do the platelet-rich plasma. 1, 2, 3, here we go. And this gets injected right into the cleavage area, just like this. Super simple, easy peasy. Okay, ta-da. See, the main part of the treatment is actually just getting everything ready. Treatment itself goes pretty darn fast. Okay, and now we're gonna go up top. One here, ready? 1, 2, 3, ooh la la. There we go, you got it. You okay? Mm-hmm. Okay, good. So we were talking about other PRP procedures. We talked about the facial, that's PRP using microneedling on the face, neck, chest, wherever you have laxity in the skin. It's especially good for under the eyes if you have dark circles. If you came to me and said, the only thing I don't care for are my dark circles under my eyes, I would say PRP facial, and then we would do some injections with the platelets right under the eyes to give it a little extra attention there. And then of course we have the breast lift that we're doing. We can use PRP for, one again, ready? 1, 2, 3, for hair restoration. So if you have thinning hair, women or men, we can use the platelets to, the way we do it is we get the scalp ready with some special shampoo, and then you come in and we inject the platelets. So that would be like planting seeds. I like to use the gardening analogy. So we plant the seeds, and then we use microneedling. Turn a little bit on your, yeah. And as we will microneedle some platelet poor plasma all over the scalp, so it'd be like rototilling. And then we have special serum that's like a fertilizer. And you go home with that, you use that twice a day. And then we have a laser cap that is like a greenhouse. Or somebody said the other day, it was like the sun. Like, yeah, you're right, it's like the sun. So let's do one more right here, la la la. So that's the way the PRP hair works. It's not for bald spots, but it's for thinning hair. So if you have hair that you see is receding and you want it to stop, PRP is great for that because it will help stop those hair follicles from dying. If the hair follicles are already gone, then you can't do much about those. And then of course we do PRP for sexual wellness, which means the Priapus shot, which is for men for erectile dysfunction. One more here, sorry about that. And that helps with, if you're needing to use Cialis or Viagra, you may not even need those anymore if you do PRP. So it's a pretty simple procedure as well. We would just numb up the area with both numbing cream as well as an injection after you're numb with the numbing cream. And then we inject into the penis in about 5 different places. The worst pain out of 10, typically get a 3, or if there is any pain, it's maybe a 3 out of 10, with 10 being the worst pain ever. So it really is not hurtful. And then the platelets become brand new blood vessels, which are helpful, especially if you have diabetes or high cholesterol or high blood pressure, because those little tiny vessels can get clogged, and then that doesn't help with erectile function. They also make brand new nerve endings as well. So, and then of course PRP for women would be called the O shot, and that is another option. Again, brand new blood vessels, brand new nerve endings, but really important in that procedure is that we inject into the pelvic floor, and that will make new pelvic floor muscle cells. So if you have stress urinary incontinence, that is a significant, you get a significant improvement with doing the O shot. So, all right, well, we are done with that breast. We're gonna move on to doing some PDO threads next. Another option for patients would be, we could inject filler if on the top part to give immediate results and to keep the results going until the PRP has time to really kick in. And a third option would be to do a scarlet procedure, which is microneedling and radiofrequency that helps tighten and lifts. So it's a great way to just bring the nipples up and give a little bit more lift to the breast, even more than what we're doing. And if you guys have watched my videos, you know I love to combine treatments because I think the combination is always synergistic as opposed to just being additive. So when you combine treatments, it's not 1 + 1 doesn't equal 2, but 1 + 1 = 4. That's my way of explaining what synergy is, but they just work off each other. So you did great. Thank you for being a model, and we're going to move on to doing PDOs next.